So what he hadn't done for all those years is put any load through his spine. He tried everything else, chiropractic, osteopathy, physiotherapy, but he hadn't actually put any significant load through it. The first one that springs to mind, I think, is a young weightlifter who's been in trouble for, I think it was 5 to 6 years in total. He had come to me after seeing a spinal surgeon, I think he'd seen a rheumatologist and a pain clinician, all of which had offered some explanation for his troubles, but unfortunately the problems hadn't resolved. So when he attended, he was describing intermittent but very intrusive low back pain. So he was scoring that on a regular 8 out of 10 on a self-described scale. So he was sufficiently troubled to stop him going to the gym. He was having trouble sitting and he was having trouble with all his activities of daily life. When I reviewed his MRI reports, one of the features that was most relevant was something that is disputed, but I'll describe, and that's that he had a full thickness annular tear in his L4-5 disc. So that's the disc that's up from the base of his back. And annular tears are when there's, for want of a better term, a rip between the outside and the inside of the disc where the fibres have been torn or separated, allowing or potentially allowing some of the central disc material to ooze or to prolapse out. So, but he didn't actually have a slip disc or a prolapse disc, but he just had the tear. So in many textbooks and with many clinicians, this is considered to be an incidental finding on MRI. But I think in his case, he had a significant moment when he was lifting. He was going for a personal best with a squat. Unfortunately, he lost his form and he did experience a ripping sensation at the base of his back, and his problem stemmed back to that moment. So I think it was very relevant in his case that he had what we could, for want of a better term, describe as a toxic annular tear rather than an incidental or asymptomatic annular tear. So classically, if you're thinking that someone has a symptomatic annular tear, then you divide the program into two. So number one, can you help control the immediate symptoms? And then number two, what can you do to foster healing of that disc so that this young chap can return to his enjoyed and chosen way of life? So for him, he was very fortunate in that he really did respond to the use of anti-inflammatory medication. Prior to my recommendation, he was told, well, try ibuprofen here and there, try codeine, try paracetamol. But of course, as many people do, they give it a few days here and there, and he thought, oh, the effects weren't good enough. But when he used an anti-inflammatory, and in his case it was naproxen, sometimes it's a different one, but in his case it was naproxen, he actually gained more and more benefit as he was taking it week after week. So we had some suppression or some control over the symptoms, and then we were able to start trying to stimulate the healing process in that disc. So what he hadn't done for all those years is put any load through his spine. He tried everything else, chiropractic, osteopathy, physiotherapy, but he hadn't actually put any significant load through it. So I followed a program described by Professor Stuart McGill, a spinal biomechanics researcher who is now retired but still practicing clinically in Canada. And he described, for want of a better term, a loading program that could stimulate the body's own healing mechanism. And for this young chap, he went under a bar so that he could just do a mini squat, and he was genuinely just doing 5 simple, loaded, comfortable reps once a week. That made him a little sore, but not too intrusive. But as the weeks went by, he was able to put more and more load on the bar, and he was able to go down a little bit deeper, but not anywhere near the point that he would lose his form or lose the shape of his spine or control as he was doing it. So a few months in, he was describing his symptoms to have reduced to about 50% of what they were. And by the time we got to 8 to 9 months, he was describing being almost symptom-free. By that time, the gym routine had extended to a full program of aerobic exercise and a full program of strength and conditioning. He'd already been doing some core stability work, so he had an excellent core. It's just that that wasn't helping his symptoms previously. So the only difference there was this loading program to stimulate the body's own healing mechanisms. So when I last saw him, he was in good order, he was symptom-free, he was up to very reasonable loads under the bar, and he was enjoying training, back to all his normal life. And so we were describing then an ongoing program that he could continue to enjoy independently, touching base with me only, and if necessary.